Hey, good morning, good afternoon, and good evening for folks on the webinar. Thanks so much for tuning in. This is a DHCD sponsored webinar for how to use the Community Development Block Grant resources in response to the COVID-19 pandemic. On this webinar, we're going to go through some of the ways CDBG can be utilized currently to meet COVID responses, but I wanted to draw some attention to some of the other DHCD resources that are out there. And so that first link on the slide will take you to the DHCD webpage, where we have tried to identify all of our DHCD programs in response to COVID-19. Wanted to point out a few just recent announcements. The $2.5 million that was recently announced for emergency shelter funding. DHCD has made a big effort to try to mobilize resources in response to helping some of the homeless and rapid rehousing clients or partners serve those populations so they can be isolated or provided testing in case to meet their needs, so that they are taken care of and not exposed in large groups and populations. Additionally, I wanted to point out $300,000 for some of the small business assistance that was made available to the Virginia Main Streets. This funding was only for the designated communities, but I believe it was 26 or 27 communities that received some direct small business assistance. Those communities and businesses are a vital part of our mission for small business support, and that's one of the first efforts that DHCD has rolled out for small business support, but it's not the last. We have a lot of conversations internally going on about how best to utilize CDBG, our state resources, as well as our other federal resources in response to small business support. I'll talk a little more about that in the coming slides. But I also want to take a chance to mention some of the coordination that DHCD is undertaking with our building and fire regulation staff, as well as the International Code Commission, or Council, International Code Council, to look at how we can help building officials. We're partnering with VDEM, the Department of Health, Social Services, as well as our regional and local partners to really try to coordinate and best address the needs that are happening in response to COVID-19. So stay tuned. We're going to walk through this together. For CDBG, traditionally has been a program for infrastructure and kind of helping housing rehabilitation, small business support through business district revitalization, or addressing some of the urgent needs such as natural disaster recovery. DHCD has been administering the CDBG program since 1984, but CDBG has been around since 1974. It addresses three national objectives: the benefit to low to moderate income individuals, slum and blight elimination, and urgent community development needs. As a state, Virginia, we use CDBG funds primarily to address low to moderate income benefits. For those of you that have worked through the CDBG program, that's predominantly the project that you probably have worked through. We have also done some downtown revitalization to address some of the slum and blighting elimination. And then the urgent need category for us has traditionally been, like I mentioned before, helping the recovery efforts after a national disaster. So helping after a tornado relief, flood relief, the earthquake a few years back, aspects like that. As an overview, this webinar and as well as this funding is really going to primarily benefit the non-entitlement communities. So non-entitlement for CDBG as a state are generally the small cities, the rural areas, and the towns. And so you can get a listing of that in the program design available through the DHCD webpage. Most of those entitlement communities, the larger cities, actually receive their own direct allocation of CDBG resources from HUD, so they're not able to be served by this current effort through the CDBG program. We are, however, trying to be as flexible as possible and allow pass-through funding. So if we directly contract with a locality for CDBG funds, they can pass that funding on to a nonprofit or a healthcare provider or a partner in the community to meet all the needs of COVID-19. We are still abiding by the 2020 program design in an effort to service kind of COVID-19 response. It'll fall under predominantly the urgent need classification. So we are looking at doing public service oriented projects. We can do construction oriented, but urgent need kind of national objectives allows us a little more flexibility to meet some of the local funding priorities. So in response to the governor's declaration of emergency on March 12th, DHCD kind of has prioritized $6.5 million of our current 2020 CDBG allocation. And what that means is we're taking our program dollars that would traditionally do some of our community economic development fund, our local innovation, or our urgent need projects that would come in on a rolling basis throughout the year. We're repurposing some of those funds in response to COVID-19. We are still undertaking or receiving applications for those traditional activities. So if you have projects or ideas, please feel free to submit those for economic development or urgent response. We're just making $6.5 million also available. That is kind of flexible and to meet the needs of localities in response to COVID-19. We do anticipate future CARES Act funding to align hopefully in a couple weeks, and we'll talk more about that at the end of this. I want to make sure this is known that there is $6.5 million currently, and it'll be in addition to the $11 million of the CARES Act. And we will not, we will make sure we still service a lot of the applications that we get through CDBG, as well as undertaking the COVID-19 response. It won't be an and or. So as we start into some of the eligible activities, on the DHCD webpage, you'll find an infographic as well as a 2-page response that outlines how CDBG will be rolled out through this effort. We've identified 4 or 5 bucket areas. I want to make sure we walk through and give some examples of some of the higher level ones. So really to meet the needs of some of our homeless or our the instability in housing population, you can construct or rehab structures that will create kind of an isolation or testing facilities. We're trying to work with some of our homeless shelters or some of the local efforts to use motels or hotels to house and keep people stable so that they're not having to be exposed in large groups or exposed to other populations that may have be in transit. So creating shelters or isolation facilities has been a primary push for some of these CDBG funds in a coordinated effort with a lot of the continuum of care partners around the state. We are looking at supportive housing residency structures, as well as some rent and utility payments. This is predominantly, at this point, predominantly structured toward some of the most vulnerable population, the low income or the unemployed. It can pay some mortgages for those that are recently unemployed or have experienced a job loss as a part of COVID-19. What that will do is have to have a intermediary, whether it's a county or a nonprofit organization in a partnership with the locality to actually make those payments to a bank, to a lender, to the utility companies on behalf of the beneficiary. DHCD is happy to walk you through kind of the parameters around some of that rent or utility payments, but that is eligible currently under the CDBG guidelines. For acquisition of telework and telemedicine services, we are generally looking to address a healthcare provision. So those partners that are looking to allow for virtual client visits, we've heard from a couple community service boards about how to keep conducting mental service checks on some of their clients, how telehealth, whether it's general medicine or specific and targeted medicine outcomes, can reach some of their rural populations. The equipment or the extra efforts that will take to make that happen virtually, we can try to see if CDBG would be a fit. That's kind of the healthcare provision is kind of the primary response that CDBG is undertaking in this arena. Laptops or equipment for local government employees is not a priority at this time. for CDBG funding. As the situation evolves with COVID-19 and as we see how the CDBG funds roll out, there might be some exposure or allowances for some of those local government employee equipment. But for local governments, if you're figuring out ways to conduct public business, if you're trying to engage the public in solutions or ideas, allowing your city council, board supervisors, town council meetings be publicly supervised and receive that public participation, that might be an avenue that CDBG funds can help you facilitate. We'd love to see more public participation even in times of isolation and social distancing. And as I mentioned before, one caveat is we are trying to work with our building and fire regulation staff to look at some responses for building officials and code enforcement, looking at funding that may be available in that space to also partner with CDBG funds in an effort to really engage some of the rural area providers so that housing and commercial construction doesn't halt, with the aspect that some of these officials aren't allowed to go inside residential houses in response to the COVID-19 effort. So we're looking at ways to kind of virtually do business, and if it meets a public benefit, we want to try to work to see if we could help the locality meet that need. Food security has become a really large need, and so we want to make sure that we're helping localities address those challenges. We've had some issues where food banks are not able to get food, or they're not able to get that food through a delivery mechanism to the end beneficiary. And so if we can help in that whole line from food bank to end result or getting access to food banks, we're working with the Department of Social Services, Department of Education, as well as Department of Emergency Management to make sure that we have a food security task force in a coordinated effort to really drive the funds to the appropriate sources and get those food security issues shored up. We have a couple examples of where we've worked with localities just recently to help either in a local school effort where they had a worker that was helping to prepare meals for families test positive for COVID-19. There was a community response to engage local businesses to create those meals and then have volunteers deliver them instead of the school employee workers. That was a great effort of where local businesses benefited from some business, and then the families still received the meals. So thinking through creative responses on how to bolster that food delivery program, but in a non-duplicative manner, is what CDBG funds can help fund. And lastly, the main big bucket area is small business assistance. So CDBG has traditionally helped a lot with large and small businesses. Bringing in and retaining businesses in the community is a staple of CDBG. But in the COVID-19 response, helping businesses create either personal protective equipment or the products that are needed so drastically in the frontline response to COVID-19. We've had a couple businesses actually retool their equipment to help make PPE products or repersonalize some of their staffing time to help create those PPE. So we've worked with a couple of distilleries now to repurpose some of their distilling equipment into making hand sanitizer, or helping them purchase products to increase the volume of hand sanitizer they can make and distribute. We've had one manufacturer start ramp up production to make more ventilator parts in response to the contract for creating more PPE. This is a job retention aspect, so we're looking at how many people can be retained as employed, or job creation, how many more people can be brought on to create the additional demand. And so there are some strings with both of those which DHCD staff can walk through, but there is an opportunity hopefully to get some grant funds to a business to ramp up or retool their structure, the current structure. For small business assistance, DHCD staff are engaging with a lot of other task force and agencies to really try to make sure the CDBG funds hit the targeted audience of small business support. There are a lot of resources out there that are driven towards small businesses, And so we're trying to make sure that CDBG is targeted in the most beneficial way. So there'll be some guidance in the upcoming days as to what small business support looks like for CDBG funds, but know that DHCD is dedicated to making sure we have a response to small business support, as well as identifying and making sure everyone knows how to use that resource. So stay tuned for that. We may have to do another webinar or make a podcast available to let you guys know, but we will reach out and make sure that the small business support documentation is available. So for the application, we've tried to simplify the application process a little bit so that we have just a letter of interest, a shortened application process, and then the county's or localities' responsible activities. There has to be 2 public hearings, and then some of the pre-contract activities such as an environmental review, Section 3, and other documents needed to be undertaken in order to get under contract. I want to kind of focus on some of just the higher kind of issues or higher responses needed. The letter of interest is generally a placeholder. It's a letter in response from the locality on letterhead that is signed by either the county official or the locality official or the mayor, board of supervisors, supervisor, chairman, etc. It's a response to just notify DHCD that this is kind of the intent of the project, and these are what the issues we're trying to deal with. The project description, the need, a lot of the budget things will come with an application. So once the locality submits the letter of interest, DHCD staff will reach back out and ask a lot of the identifying questions so that we can get to a product that's going to help us address a lot of the CDBG responses, but also get to the underlying need for the funds and how we're going to address those needs. So the budget, timeline, partners, and other necessary documentation will happen during the shortened application process. The letter of interest and the application can really be as fast as the locality can move. So it's not necessarily driven by a certain length of time. If there's a little bit of time to figure out some activities or get some more information, it may take a few days, but this process could be 3 or 4 days minimum, or as fast as we can go. However, the public hearing process, there is a need to undertake at least 2 public hearings, and I'm going to go into that a little bit more in two more slides. But the contract process, I have to make sure everyone's clear that there are federal regulations that require us to do an environmental review. There is a need for agreements between the locality and any service providers that they may have to complete the project. So if that is to provide sheltering operations, if that's to provide food staffing, how are you going to do this, and what's the who are the partners you're going to undertake to do that? There also is going to be, especially in the small business arena, a certification that that partner is not going to seek additional funding from another resource to do the same activity. We need to make sure we're not duplicating funding sources for these activities. So just know there's a few certifications and activities needed to get under contract. Public hearings, if you've undertaken a CDBG activity in the past, you'll know that there is generally a longer public hearing requirement. If you look at the DHCD website, which I have a link on the next slide, we have some shortened guidance to kind of meet some of the COVID-19 scenario, the situation, where it's kind of hard to engage your public body in a public meeting as we've traditionally known them. So the first public hearing is more just to solicit general participation or input for how CDBG has been used in the past by the locality, and just generally the project ideas. You don't have to know all the specifics of the project at this time, whereas the second public hearing, you're going to need to have project specifics, everything outlined for that meeting, as well as probably adopt the resolution to proceed and any contract documents you would need to have for the project. These meetings need to make sure you have public participation opportunities available. But the timing can be shortened so that you're meeting a reasonable notice to the public to participate. As I mentioned, these meetings can be virtual, and they can really engage the public in a variety of ways. So you can use a lot of the formats of Google Hangouts, like Adobe Connect, like we're doing today. If there's a format your locality already utilizes for engaging the public, is generally going to be acceptable as long as there is a way for a citizen to ask a question and receive an answer on the fly in kind of a live process. I would encourage you all to undertake additional public input processes through social media, through your email, or through your newspapers, just to engage a wider variety of people for your project activities. For additional resources, again, see our website for how to conduct a public hearing. And then lastly, one of the big items for COVID-19 response is reimbursement. We have developed a reimbursement policy for COVID-19 response that can be found on our website in that top link. This generally is eligible for all the public service activities that will be undertaken through the CDBG and the COVID-19 response. So any expense incurred after the May 12th Governor's Declaration of Emergency could potentially be reimbursed. We want to really be as flexible as possible and trying to work with the localities and their partners to meet this need, but it's probably the best practice to have a lot of these expenses incurred through a standard or emergency kind of procurement process. It's not a mandatory, but it will help expedite some of the contract documents, and through a contract process we'll probably undertake and examine some of the purchases you may have already made just to make sure they're reimbursable. But with the reimbursement policy, we feel comfortable identifying some of the COVID-19 responses undertaken by the locality and working with you and your partners to reimburse for them. If you have any questions on that, as you're developing your project, let's talk about it so that we can get to a comfortable level for all parties before we move to a contract. So lastly, I want to touch base on the CARES Act funding. So as we've gone over, this current $6.5 million is separate funding from CARES Act funding, but we see this as a true opportunity for us to pilot some opportunities of getting funding out to meet the locality's needs in an effort to also then build off of the CARES Act funding that's available. We're anticipating approximately $11 million coming to the state through the CDBG program. There will probably also be some additional CARES Act funding coming down the pipe outside of this $11 million, but for now we're focusing on $11 million, hopefully in the near future. We have not got a deadline or a date for when we can expect that funding, but we want to use that in a similar way. So if we can build up the $6.5 million we have available now into a project pipeline to meet that $11 million, we'll just continue and keep funding projects to go through the CARES Act funding in response to COVID-19. We have, so you all know, DHCD has reached out to our congressional delegation as well as HUD to ask for several waivers for our CARES Act funding. We want to make sure that we're being as flexible in meeting the locality's needs and really driving these funds into your hands to help your localities. So some of the waivers that we've asked for include the opportunity to work into entitlement areas. So if we can partner with some of our entitlement funding sources, as well as the providers that serve entitlement and non-entitlement areas under their service footprint, if we can help them, we see it as an advantage as well as an efficiency standpoint to fund the sources that are helping the most beneficiaries at one time. A lot of providers don't see locality boundaries as a barrier, and so if we can support their efforts across those entitlement boundaries, we'd like to do that as a state. Another one is actually very similar in that we're hoping to be able to contract and fund regional entities to do service provision. A lot of our PDCs, a lot of our healthcare and service providers work across local boundaries. And so again, in an efficiency standpoint, being able to contract directly with them and get that CARES Act funding out would be a huge benefit. We don't hold any of these requests as guarantees. We are requesting the funding, so stay tuned for what comes out with the CARES Act and what HUD allows us to do. But we do anticipate all the activities that we're currently committing to with our $6.5 million to be eligible for the $10.9 million of CARES Act funding. We're hoping that we'll be able to get a contract in the next 2 weeks and roll that out in mid-May, but stay tuned for the availability of CARES Act funding. So there have been several questions that I've tried to answer as a part of our webinar today. We want to make sure that this webinar, as well as all the questions asked and the answers associated with those questions, are available to you all on the DHCD webpage. So if you have any additional questions, please feel free to reach out to us. We'd love to chat with you about potential ideas or projects, as well as direct you to our funding partners so that we can truly try to address the COVID-19 response. With that, I bid you adieu. Hope you have a great day.